not star-crossed like Romeo and Juliet.
Oh, wow. Well, in good health, a new study suggests false positive results from mammograms may not be quite so false after all.
They actually could be an indicator of future cancer. Dr. Frank McGeorge is here to put some perspective now on this potentially worrisome report. Doctor?
Well, that's right, Devin and Ruth. You know, here's a fact. The majority, nearly 2 out of 3 women, well, they're going to have at least one false positive mammogram in the course of 10 years of screening. So the question is whether that false alarm is just a nuisance or if it could mean something in the future. And the answer is, it does.
When a mammogram picks up a suspicious area on a woman's breast, she undergoes further testing, sometimes a biopsy, to find out if it's really cancer. If it's not, it's called a false positive, which is reassuring to women. Now, a large study suggests some of those false positives may be an extremely early warning sign of cancer that will someday grow.
Having a false positive is really a piece to the puzzle of breast cancer risk.
Dr. Louise Henderson of the University of North Carolina, Chapel Hill, led the 15-year study of more than 1 million women. Those with a history of false positives had a slightly higher likelihood of later developing cancer. The explanation for this finding is unclear, and this does not mean false positives will always turn into cancer.
The vast majority of these are quickly shown to be not of concern, and that whatever increased risk there might be down the road is a very small change in their overall risk and not something they need to be especially alarmed about.
Other risk factors for breast cancer, like age and family history, should also be taken into account along with this new finding when planning future screening. And as always, women should speak to their own doctors to understand their personal risk.
Now, this study found that the risk of future cancer increases 39% with a false positive mammogram. And while it's accurate, it sounds really alarming, 39%. But that does not paint the complete picture. A better way to really look at it is normally about 2 out of 100 women will develop breast cancer, no matter what. Among women with false positive mammograms, it is 3 out of 100 women. It is an increase, 1 out of 100 women, but that single increase should not cause alarm. It's just something we need to factor into future screening.
And you need more studies probably in the future.
Precisely. And this,
more information.
Exactly. And this study was not designed to look at outcomes or anything like that. So
because it still means that some women get false positives and it means nothing and they never
precisely. Not a reason for panic, something that needs to just be filed away.
All right.
Good.
Thanks,
Good
Frank.
explanation. Thank you, Dr.